Professor Chandra Mohan Vadi from Hyderabad, India. Professor Vadi will talk about thulium fiber laser anatomic enucleation of the prostate. Please, Professor Vadi.
My dear urology colleagues, at the outset, I thank the organizing committee of Military Medical Academy Sofia, particularly Venceslav Mutovsky from Bulgaria, Ilya Saltrivo from Bulgaria, Kremina Petkova, who's my friend from Bulgaria, Kemal Serika, who is very dynamic urologist from Turkey, for inviting me to talk on this topic during 12th meeting Endourology and Minimally Invasive Surgery. My talk is Thulium fiber laser anatomical endoscopic enucleation of prostate. I am myself Dr. V. Chandramohan from southern part of the India. No conflicts of interest. Anatomical endoscopic enucleation of the prostate is in the form of HOLEP, that is holmium laser, bipolar enucleation, thulium fiber enucleation, and thulium laser also enucleation, diode laser enucleation. Now recent entry is thulium fiber laser, that is THUF-LEP. Thulium fiber is different from thulium laser. Thulium fiber laser is recent for last 2 to 3 years. The one which I am using is IPG photonics. It is ions will be pumped by diode laser electronically modified to alter temporal beam profile. This will go through thulium doped 10 to 20 micron core diameter, 10 to 30 meter long silica fiber. Most of you know and have seen this diagram. The properties are higher water absorption coefficient than holmium, 2 times of the thulium fiber laser and 4.5 times of the holmium laser. Translates into lower tissue ablation thresholds and faster enucleation technically. So pulse profile is the holmium YAG pulse profile is irregular, losing lot of energy with spikes and rapid decline, while the TFL is almost like a square wave symmetrical, producing a constant peak power. This you can see laser beam profile is very narrow and very cylindrical. Precise cutting depth penetration is 0.15 mm, 2 times less than thulium YAG, 4 times less than holmium YAG. So with this diagram you can understand that the cutting property is very good with thulium fiber laser. Short learning curve I have been using for last 3 years, one of the earliest to use thulium fiber laser in India in 2018 December, the moment it is launched. After that, as you all know that it is CE approved and FDA approved now. The paper from urology, the authors found that thulium fiber laser enucleation of prostate was associated with simple learning curve, achieving proficiency as well as 8 to 16 procedures. In fact, true for me also, in comparison to 50 to 60 procedures in HOLEP, predominantly because it has precise cutting as well as the coagulation. Large vessel also can be coagulated so well. Faster enucleation rate is reported again in the same article by Enucleation, who is pioneer in thulium fiber laser from Russia. He says that it is superior to HOLEP by 1 gram per minute versus 0.8 gram to 0.7 grams per minute. Even he says that 25 and 42% faster enucleation when compared to these lasers. However, it is not statistically significant. Erectile function is very difficult to comment. There are various factors involved. However, mean erectile function score 5 score increase of 0.72 in thulium fiber laser compared to decrease of 0.24 in TURP patients, which is statistically significant. Thulium is more likely to preserve the erectile function, leading to increased IIF 5 at 6 months. In contrast to TURP is the paper again written by Dimitri and Kiev in this BMC urology paper. The environment friendly is mainly TFL consumes almost 10 times less energy. Wall plug efficiency of the TFL is 12%. Holmium YAG laser is only 1 to 2%. Any plug which is used for the hair drying also can be used, and which is very lightweight. This machine is literally no noise in VOT when compared to Holmium, because there is no cooling mechanism required, no fan required. Definitely noise hazard is very less. Instruments are like any other instruments of laser enucleation. You need a working element with a channel for laser fiber of 550 micron fiber, and rest of all the things depends on your routine. Most of the working elements we use these instruments, which are shown only 5 to 6 instruments, and I have already shown here 600 micron fiber IPG, which is a large fiber used for the enucleation. And you can see the assembly. This is a simple outer sheath and inner sheath of the TURP, like any other TURP rotating type. This is the TURP standard loop 1, which is commonly used for TURP, and now the same thing is replaced with the laser one. You remove this and put the working element with laser fiber instrument which has a special design. You can pass laser fiber by the side of this, and it has a simple mechanism of closing so that the laser fiber does not move during the surgery. There is a white cap given which snugly fits into the, this is a white cap, so that the water leak will not be there. You can observe that. Unfortunately, the nephroscope goes through this inner sheath also at the end of the surgery. This is the laser fiber insertion from here, and it will come out from here, and then you can fix by rotating. This is the movement of the laser fiber instrument. Otherwise, most of the times laser fiber is fixed, there is no need for the movement. And this is the obturator with laser fiber insertion. This is a simpler instrument made in local region. There is no working element. You only sweep, you don't move front and back, you rotate through the laser fiber the enucleation of the prostate. So this is the one instrument which is used for the other instrument used for the enucleation. And now settings are: incision is 1.5 joules and 33 Hz we use. This thulium fiber laser has wide variety of settings, so that one should be oriented towards the best settings by using 5 to 10 cases. Then these are the settings we have made: 0.025 joules and 240 Hz. That is a big advantage of thulium fiber laser for hemostasis. You can see here en bloc resection video. This is the secondary stones, so that you can remove the stones in one go through the sheath. This is the advantage. All the small stones are there, they are all removed. A large stone, thulium fiber laser is very good for the stone also. Make designer cut and take out this fragment without disturbing much in the bladder. You can see around 80 grams of the prostate. The standard inverted U incision is a standard. If you keep a little away, it works almost like holmium laser. You can see clearly how the fibers are seen here. A little bit of mechanical movement here made the plane clearly. You can, any enucleation surgeon can identify the plane here. See, can you see? And directly you are going to the, see, this is a sphincter, and now you use the laser fiber. A little bit of mechanical rotation is used with this laser, but very minimal. And if you keep away, the faster moving of the laser fiber quickly incises the plane. We are at the 6 o'clock position, lifting the gland. Initially you lift only 1 to 2 centimeter at the 6 o'clock position. In fact, we are showing the mucosa like that. You can clearly appreciate the laser fibers here and moving away like in Holmium 100 watts laser. To be honest, this is more cost effective and less energy used here. Now see, between 6 o'clock to 8 o'clock position, the working element is moving here. The coagulation effect is very good. Now I am rotating towards the 9 o'clock position. So now we will go to the, see, entire lobe at the 6 o'clock is lifted nicely. We will get an idea where we are now, and straight away go to the retropubic region at the pubic symphysis level. That means 12 o'clock position we are entering now. If you develop a plane after releasing the mucosa at 12 o'clock position, it is very easy to develop plane here once you incise the mucosa, so that traction on the sphincter will be less. And see, directly the plane is going into the retropubic region here. All the lobes of prostate are one here, that is en bloc. There is no need of incision anteriorly or posteriorly. That means the roof as well as the floor, it is one. The same plane will meet the previously developed plane. See how the sphincter is here, mucosa is not disrupted. No damage of the mucosa here. So with this, you develop the plane and go straight in the retropubic region without leaving any part of the prostate, directly to the bladder, and push the entire lobe. First develop the plane at the 12 o'clock, enter the bladder, which is like standard. After that we are pushing the last part of the lobe here. Because of the time constraints, I am little fast forwarding here. You can coagulate the definitive bleeders. Usually bleeders will be less unless we open the capsule like in any other enucleation. Now once you are inside, the marcellation part is the same. See, you can see nicely all the mucosa intact at the sphincter and the contractions you can see. The marcellator technique is, marcellation is the same. You should be careful that the bladder should be distended, vision should be clear. Now the 130 grams prostate quickly I am showing here. The technique is same. So large median lobe is present. Even then enucleation is possible. This is the large median lobe. I am showing the beginning part and the ending part. We have not given any incision at 5 o'clock and 7 o'clock position. Now you can see at the beginning of the procedure it looks like that. Now at the end you see how it is done. Beru intact and all the sphincter is intact. Mucosa around the sphincter is intact. You can see nicely the sphincter region where the mucosa is intact without any damage. Now you go inside to see a large prostatic fossa without any prostate tissue, so that the IPSS scores will be much better. Definitely large amount of the prostatic tissue can be removed in enucleation. You can see nicely, appreciate, without any bleeding in this large gland. So World Journal of Urology recently says that enucleation is enucleation, It's not the equipment that is responsible for the efficiency of enucleation, but the enucleation technique whereby complete removal of the obstructing adenoma is achieved. So my dear friends, Thulium fiber laser is a new tool. It's only the technique which we developed, we are doing with a new tool. Today I feel that this tool is useful in enucleation as well as the stone surgery at a lower cost as well as lower energy usage without any noise and with reasonably early good results. Only future randomized control trials can tell whether it will survive or not. Try and try till you succeed. Mistakes are proof that you are trying. Thank you very much for giving this opportunity once again. Thank you.
Another question to the...
Yes, the next question is to Professor Vadi. The question is, does the thulium laser have less hemorrhagical complication than the holmium laser? What's your opinion?
First of all, I thank organizing team for giving the opportunity. Honestly speaking, holmium laser is time tested. I have done only 50 cases with thulium fiber enucleation. What I noticed is coagulation effect of thulium is very good. The lifting of the large lobe with holmium is much better than thulium fiber laser. I have used both. Thulium fiber laser, when you go in contact with the tissue, it becomes charred. However good you use that. It needs some skill, but only advantage is whenever bleeder comes, large vessels are the place, coagulated very fast. So for a beginner to start with, it looks easy, but complete enucleation like holmium may not be easy with thulium. That is my experience.
Okay, thank you, Professor Vadi. The next.